Good morning. Welcome to the Community Voice. I'm Steve Gradick, your host. Delighted to have you with us. We're grateful to our sponsors, Tanner Health System, Oak Mountain Academy, and we're also very grateful to our guest, Dr. Laura Larson. Good morning, Dr.
Good morning.
Larson. We thank you for, and we don't say this enough, we thank you for coming on a regular basis with us to keep our audience up to date. We also make note that we've archived several of our previous shows to Rumble, to YouTube, to Facebook, to our website. And so there's, as we, try to cover everything, we kind of jump around from program to program. So we invite everyone to go back and listen to previous programs for a variety of topics. Dr. Larson's Medical Director of Infection Prevention for Tanner Health System. Is board certified in both infectious diseases and internal medicine. She earned her medical degree from Mercer University School of Medicine and completed her residency and fellowship at Shands Hospital at the University of Florida. She's on the American Board of Internal Medicine Infectious Diseases, certified, I assume, and chairman of the Carroll County Board of Health. Well, again, good morning. And as we, unfortunately, has become a routine, if you would give us the latest Tanner stats.
Sure. This week looks a little bit better than last week. If we look at the percentage of positive tests over the last 2 weeks, we're down to 21.6% of everyone we're testing is positive. But in the last 7 days, that number is down to 17.6%. So we hope we are seeing a decline from our peak. As of yesterday, we had 84 patients in the 4 hospital systems, so we're under 100 this week. Carrollton had 54, Billerica had 23, Higgins had 6, Tanner East Alabama had 1. So that's a reduction just in 14 patients since Saturday. COVID-19 patients in ICU beds, we had 15 that were in the beds with active COVID plus 12 resolved COVID infections. And we call those people that have survived COVID and that are 20 days out of resolved COVID case because they're no longer infectious. So overall, our total mortalities are 421. We had 10 deaths since Saturday. So that's where our numbers are right now.
Can you interpret from those numbers that we've surpassed or gone beyond the peak of the variant outbreak?
Well, our peak was much bigger this time around, the end of August, beginning of September. So, and that, we know they're calling this the Delta wave. So I'm hoping that is what is on the decline right now. Okay.
Let's move into some topics then of the morning. I was really glad back in February of this year to receive my 2-shot Moderna vaccination. But I understood the efficacy was 95% then, but now I'm understanding the efficacy has decreased. Can you tell me by how much?
Well, they think it's about the mid-80s for prevention of COVID. But again, the most important reason we get vaccinated is the prevention of hospitalization and death. And so they just came out, the CDC published a morbidity and mortality weekly report, and that was early released on September 17th. And they looked at specifically the vaccine's prevention on hospitalizations, and it was pretty strong. So Moderna prevented 93% of hospitalizations, the Pfizer vaccine prevented 88% of hospitalizations, and Janssen 71%. So that's still very high efficacy on the endpoint of the vaccine's effectiveness because, it's just like other vaccines, like flu vaccines, the endpoint and the outcome is not whether or not they prevent the disease, it's whether or not they prevent you from getting sick enough to die. And so, again, even though the efficacy dropped with Delta, the efficacy for hospitalizations is still very high.
Okay, but now I'm understanding there's a lot of disagreement about booster shots. We had a couple of FDA staff resign, and Pfizer's got an approval for boosters for people over 65. But apparently there's safety concerns. What are there?
So, the safety concerns are causing pericarditis, myocarditis, or inflammation of the blood system. And that's because COVID is a potent inflammatory agent causing clots and myocarditis and pericarditis. So the protein that actually causes that is the spike protein because it enters the ACE receptor of the cells. So the vaccine is also modeled on that same protein. So much to a lesser degree, some people are getting pericarditis and myocarditis after vaccination. And so the whole idea of the boosters is how much booster should we be giving? Now, for people that are immune compromised, boosters are already recommended because they're not getting those side effects because their immune systems are compromised and they're not having a stronger reaction to the vaccination. But the question on the boosters is whether or not we should be boosting with a smaller amount of virus, of actually proteins. So that's why it's so controversial right now, and the scientists are arguing back and forth on what is the appropriate dose, what is a safe dose in people that don't have immune system problems. And it also depends on your risk. So there's some information potentially that's coming out of California from public health studies out there that healthcare workers are at high risk, so it's worth the benefit of the vaccination, to go ahead and get vaccinated at full dose. But all of that is going to be worked out, I think, in the next couple of weeks. But yes, it's a very hotly protested, and there are lots of scientists arguing over what's better for the public.
Now, I understand for those of us who have been vaccinated, if we get a booster, it can, in a way, trigger our immunity, our vaccination, if you will, to go into like overdrive, and we can create our own variant. Is there any truth to that?
I don't think there's any truth to that, because in order to create an own variant, we would have to be infected. And so that I don't think that there's any data to support that happening. The vast majority of people that have gotten boosted, and we've had over 1 million United States people get boosted, whether or not they were supposed to or not, have done very well. These risks that happen of inflammatory reactions are very low. So no, I don't think there's any truth to creating a new variant. The problem with variants is they can happen anytime. And we're looking a little bit, Mu has entered our country. Whether or not that's going to be a variant of concern for us is unknown. Right now, it's just overwhelming that Delta is the variant of concern. But variants can happen either from emergence from other countries, like the Delta came out of India, or they come from, mutations that happen singularly. They're extremely rare to happen, if you consider the fact that we've been doing this for a couple of years and we have few variants of concern. That's pretty remarkable.
I've also heard that, those of us who are vaccinated are carrying a high viral load of COVID, and we can be spreading it even though we don't have symptoms. Is there any legitimacy to that?
So the legitimacy is that vaccinated persons can carry the same amount of virus as a person that is unvaccinated, but it's for a shorter period of time. And so that's we have people saying that it's the vaccinated that are causing the Delta wave because they're spreading virus. I don't really think that that's the case. Anyone who's infected is spreading virus, but people that are vaccinated are spreading it less long. Now, the argument is there may be less symptomatic, sure, but it's one of those things that I would hope that people that had any symptoms are still being very careful, socially distancing, and wearing masks as well.
Okay, we're going to take a break, come back and hear from more with Dr. Larson. I want to ask her about natural immunity, then we can take your questions over Facebook Live if I can get my phone to work. And we'll be back with more after this.
Health is a journey. It's making better choices, even when it's not easy. It's taking care of yourself and the people you love. At Tanner Health System, we're there for you with every step, with primary care, heart care, cancer care, women's care, orthopedics, surgical services, and so much more. We're dedicated to helping you live and feel your best. So let's get on that journey to health. You've got places to be for many years to come. Find us at tanner.org.
At Oak Mountain Academy, our academic excellence shines through innovation and a personalized educational experience. Our pre-K 3 through 12th grade environment offers a family-oriented atmosphere. We are an independent school with faith-based values and an Academy Honor Code. Our academic standards prepare our students for college and beyond. I'm Patrick Duran, headmaster, inviting you to visit us on the mountain or at oakmountain.us. Come see how our warriors are creating legacies.
Good morning. Welcome back to the Community Voice. I'm Steve Graddick, your host. Dr. Laura Larson's with us by phone, Medical Director of Infection Prevention for Tanner Health System. Tanner just posted to our Facebook page a reminder that you can still get your shot at one of the upcoming vaccine events or vaccine opportunities near you by going to the Tanner website. Kind of at the core of the current debate, if you will, about vaccinations versus non-vaccination, or is the topic of natural immunity. And, we're hearing now that natural immunity is as good as vaccination, and an Israeli study says it's 27 times better. Where do you come down on the potence of natural immunity?
I think we don't know. I saw that Israeli study. There was also a study in MMWR that said that people that are vaccinated are 2.5 times less likely to get a new infection. So I don't think we have enough data to really know. I think that there is definitely protection with natural immunity. Just how much, I don't think that anybody has a good handle on that yet. Okay.
But natural immunity does provide protection, correct?
I think it does provide some. The people that we've seen that have been repeatedly infected, and we have people that we know have been reinfected, typically had a milder case. And so maybe, you can theoreticize that their infection was not severe enough for them to have had enough of protective immunity. But we do have, there are not that many people out there that get reinfected, but there are out there, and we think that it's people that have milder cases may not be as protected.
Okay, along those lines, Kelly Sapp posted to our Facebook page a relatable question, which is, if a vaccinated person gets COVID, are they, quote, a super spreader?
No, they've actually looked at the viral loads in the noses of people that are vaccinated versus unvaccinated. The viral loads are similar, and people that are vaccinated shed for a less long period of time.
Okay, let's move into probably the hot topic, which is children. Bring us up to date. I understand there's a lot of discussion about vaccinating kids from 5 years old to 11 years old now.
Yeah.
Where are we on that?
So Pfizer came out yesterday and said, essentially said that they're released their efficacy and safety data in children from the ages of 5 to 11, and so they're seeking FDA approval for vaccination in that age range. And I listened to a really good show yesterday from a lot of the leading children's immunization experts. And, one of the main questions is why? Why do we vaccinate children when they really aren't that sick? And the strongest case for children is that you're protecting the family. There have been a lot of people that say, well, children just don't spread COVID, and that's simply untrue. We've seen that be far more untrue with the Delta wave, that children are infecting family members. And so, immunizing children for COVID is additional protection for family members, particularly if you have family members that are, grandparents raising young children, which we do see. That's the main benefit on vaccinating young children.
If you would, and you referenced it earlier in the program, but particularly now when we're talking about kids, obviously with everything there's risk involved. How do you see the risk? And what are the risks for a COVID vaccination, both for a child and for an adult?
So for children, the risk is very low. They do better with vaccination typically than we do. They also get a lower dose of vaccination. The children in the group from the Pfizer group that are immunized from 5 to 11 did get 1/3 of the dose of the adults. And overwhelmingly, adults and adolescents that get vaccinated have a very low risk of side effects. I know that the risk is not zero, but it's very low. And if you consider how many people have been vaccinated worldwide, it's been a remarkably effective and safe vaccination for the general public. And I didn't have any qualms about having my children enter clinical study. I made sure that we were already past the safety data for, the 12 to 17-year-olds, and I enrolled my my daughters were age 15 and 17 at the time that they were vaccinated in February. So I felt very strongly at that protection and for the efficacy and safety.
Do you think we'll see mandates for kids?
No. I mean, that's just my gut feeling is no. I don't think so. It's interesting because if you look at flu vaccination, really the only place we see mandates for flu vaccination are in hospitals. And so I think it'd be very unusual to mandate the vaccination for children. I mean, that's my gut feeling. My gut feeling has been wrong. Previously, a couple of years ago, I told you I thought COVID would be over and not this long into it, and I was wrong. But my gut feeling is no, I don't see it mandated for children.
But isn't that kind of the point, whether we're talking about, efficacy or therapeutics, that we're all learning as we go.
Yep.
And as we learn, then some things prove to be not true that we thought were true a year ago, and then we're finding some things to be true that we thought were untrue. I mean, isn't there a framework to kind of put all this in perspective?
Yes. I mean, and that's what we've done. I mean, even just from taking care of patients this year compared to last year, we have a much better handle on how things are likely to go and what to do, and to give families, better guidance on what to do. So it absolutely, we're learning as we go and making, changes when they need to happen.
Charlene Aston says, my husband and I received the vaccine in January with a booster in February. Neither of us have had COVID. We are both in our 60s. When do we need our next booster? I guess she means her second shot was her booster in February.
Yeah. Well, and technically that's a correct term for it too.
Oh, really?
And
okay.
So this is, the second booster is the third shot. So if you are immunocompromised, and the indications are pretty easy to find on the internet, moderate to severe immunocompromised, the third shot is indicated now. We don't know yet whether or not the third shot will be indicated in people over 65 yet. I think that we're going to have a lot of recommendations and new guidance come down within the next month as these new studies and new information is being hashed out. So not yet, but probably very soon we'll know.
Back on the mandate thing, then before we go to a break, understand 100 plus or more employees at a business are now mandated to get vaccinated under OSHA guidelines, which I didn't know OSHA was involved in medicine, but does this apply to Tanner? And if so, has everybody at Tanner been vaccinated?
It's going to apply to us, and we're trying to work through how we're going to deal with that. OSHA is very involved in medicine. We have to, the way we wear shoes and needle stick injuries and all of that is all OSHA regulated. And so we definitely have to follow OSHA standards. So I don't think we've worked out how that's going to happen yet because it just came out and there's still a lot of information to work through. We're hoping that does improve our vaccination rate and all of our employees. I mean, it's awesome that our medical staff is over 94% vaccinated. I mean, I think that's fantastic. It just the recognition of the, safety and efficacy and the importance of, trusting the science among our medical staff, both nurse practitioners, PAs, and doctors here.
Do you think you could lose some employees as a result?
I think everybody will lose employees as a result of mandates like that. It's one of those things that it's just going to happen. Although, in one of my clinics that I work in, there were 2 people that did not get vaccinated, and they've decided to go ahead and do it now, which I'm really glad because I don't want to lose those employees I've worked with for years. So, you're just going to see different things across the board. I think you'll see some people decide to get vaccinated. I think you'll see some people decide to leave.
Our guest this morning is Dr. Laura Larson, Medical Director of Infection Prevention. We're going to come back and talk about therapeutics when we return on the Community Voice.
Health is a journey. It's making better choices, even when it's not easy. It's taking care of yourself and the people you love. At Tanner Health System, we're there for you with every step, with primary care, heart care, cancer care, women's care, orthopedics, surgical services, and so much more. We're dedicated to helping you live and feel your best. So let's get on that journey to health. you've got places to be for many years to come. Find us at tanner.org.
As a graduate of Oak Mountain Academy, I've found that my experience on the mountain prepared me beyond all expectations. As a junior at Auburn University, I approached my studies with great confidence thanks to what I learned at OMA. When I think back on my time on the mountain, I think of my teachers. Their genuine love and concern for me as a student was always evident, and now, as an adult, I still foster those relationships. I'm Carly Robinson, an Oak Mountain Academy alum. Visit oakmountain.us to see how you can offer your child an amazing opportunity to be a warrior.
Good morning. Welcome back to the Community Voice. I'm Steve Graddick, your host. Dr. Laura Larson is our guest by phone. I'm going to ask a couple of questions next, and hopefully we'll address the question of Talisha Gibson. Now, I understand that the Biden administration is taking control of Regeneron and monoclonal antibody distribution. If that's correct, why would the federal government want to ration Regeneron?
Well, we did that under the previous administration as well with remdesivir. So it's not a president deciding to ration care, because I don't think that President Trump did that, and I don't think that President Biden is doing that. What has happened is we all send in information to Health and Human Services. We send in that information daily to say how many patients we tested positive for COVID, how many patients we have in COVID beds, and how many patients we have in the ICU. And so this same thing happened with remdesivir that's happening with Regeneron. We don't have enough of the drug for everyone to get it, so it's going to be allocated to those parts of the country that are having higher rates of illness. And unfortunately, that happened to us last year too. There were times where we needed remdesivir where we didn't get it because it was going to states that had more patients infected than we did. So I think it's really important to stress that is something that has happened under both presidencies, because that's how it has to be. If we have more people sick, then we have the medications to provide them. So unfortunately, that's just a simple truth.
Now, is Regeneron only given as an outpatient, or can you get it at Tanner after you've been admitted?
No, it's outpatient. And the reason for that is that inpatients, they've studied patients that are sick enough to be admitted, and they do worse with it. If you've progressed to a certain level of hypoxemia or shortness of breath and low O2, it can progress the disease, make the disease worse. So it is something that we're giving purely as an outpatient under FDA guidance.
I know two people are unvaccinated who tested positive and started exhibiting symptoms and got Regeneron like within a day or two, and they had about a week-long terrible flu-like symptom case, but now they're, although weak, are still recovering very well. It seems like Regeneron is extremely effective if taken early.
We've seen we've seen people turn the corner with it. It's impressive.
What about, now, I think I saw a report that remdesivir, is that right, is no longer thought to be as effective as it was?
No, it's not as effective as we would hoped. I don't think we ever were convinced in the beginning that it was as effective as we had liked for it to be. You know, it shortens the duration of illness, but you really have to give it early in the course of disease. And so a lot of times patients wait until they're just so very ill to be hospitalized or to present for evaluation, and then it's at that time it's really too late to be of significant benefit.
Okay, a lot of publicity now on the and this was one question that Talisha Gibson wanted to ask. And a lot of publicity now on ivermectin. Obviously, it gets a lot of publicity because you can get it at for your horse. But it's also a prescribed medication for parasites, I believe. As it relates to COVID, good idea, bad idea, prophylactic, or
I don't think there's any data that shows it's effective. I have not written a single prescription for ivermectin for a patient for prevention of COVID or treatment of COVID, because the overwhelming medical information is that it's not recommended. The American Medical Association has strongly come out against it, only in use in terms of a clinical trial. We don't have any clinical trials locally that are looking at it. The information that's come out, we had a randomized control study of multiple trials have just not shown clinical benefit. It looked like from the early studies last year that there was going to be, but we have just not seen that hold through. Plus the doses that we've seen work in vitro or in the lab are far in excess of doses that we could safely give a human. So I just don't feel that there's enough information to warrant its recommendation at that time. And we had that same situation last year with Plaquenil. We just never saw efficacy. And unfortunately, we're seeing people admitted and dying that were on ivermectin, and it just has not been something that's bearing out as effective therapy.
We're going to run out of time. We got a question on Facebook from Analia Michelle Cutlip. She says, but if we back to vaccinating kids, if we vaccinate our kids, can't they still spread the virus? And if we're vaccinating kids to protect families and they can still spread it, if that be true, what's the overall point? Well,
the point is that in the kids study, where we look at prevention of COVID in adults, it's like, initially with 94, 95%, prevention of COVID in vaccinated children reaches almost 100% effectiveness in the clinical trials. So you're dramatically preventing the chance that child will ever get COVID. So that's the reason why I think kids should be vaccinated. You're preventing the risk of them getting it in the first place.
With about less than a minute left, this is a question that I don't think we've ever really fully addressed, and hopefully we will in upcoming programs. But risk factor for COVID is obesity. What would you say to those who are obese? This is no better reason now to lose weight than right now, correct?
Yes. I mean, unfortunately, when people come in the hospital that are obese and have COVID, that's one of the strongest risk factors that we see in a young person that causes them to progress to death. So it is unfortunately a very strong risk factor. So I would encourage anyone that is on the fence about, dieting, exercise, to do so, especially with COVID being one of the worst risk factors for progressing to demise.
Yeah, it's always a good idea to keep that weight in check.
Easier said than done.
Yeah, particularly the older you get. I will testify in court to that.
Too.
So, not that I've been in court, but anyway. All right. I trust it. How's the nursing staff doing? How's the staff doing at Tanner?
Nursing staff is tired, but they're resilient. Medical staff, I think we're good. We're so hopeful that this is truly a decline that we're seeing. So, but we're hanging in there.
Dr. Laura Larson, our guest this morning, Medical Director of Infection Prevention for Tanner Health System. Thank you for all you do and for everybody that works with you. We look forward to having you on again. Thanks to everyone for listening. Go out and make it a great day. You're in tune to WLBB Carrollton.